Good day, I am Laika Giselle Picumia from BSN 1205 and today I will be performing the return demonstration for bed making, bed positioning, bed bath, and bed shampooing. So to start, for the bed making, the first thing that I am going to do is to wash hands. Washing hands will control the spread of infection as well as the growth of microorganisms. So the next thing that I am going to do is to gather linens to be used and arrange according to use. Then, raise the bed to a comfortable working height position. Remove items to be reused, fold and place them across the backrest of a chair. Do not shake linen. Then, loose the top and bottom of the linen of the mattress. Start from the head to the foot on one side and from foot to head on the opposite side. And then, fold soiled linens towards the middle of the bed and place in the hamper. Keep the soiled linen away from your uniform. So the next thing that I am going to do is to place a bottom sheet on the bed beginning at the foot of the bed, ensuring the bottom edge is seamed side down. The next thing is moving to the head of the bed on the same side, fold the sheet under the mattress and miter the corner. Tuck hanging edge of the sheet. And then, place the rubber draw sheet about 12 to 15 inches from the head of the mattress. Tuck smoothly. The next thing is to cover rubber sheet with cotton draw sheet. It should be about 2 to 3 inches higher than the rubber sheet. Tuck smoothly and tightly. The next thing is from the same side of the bed, spread top sheet with the seam side and the center crease in the middle of the bed. Tuck at the bottom and miter the corner. Walk around the other side of the bed and make the second side in the same manner as above. Fold the top sheet over 6 inches at the head of the bed and fan fold. The next thing is to insert clean pillowcase by grasping the clean end, turning the pillowcase inside out and pulling it over the pillow. So after that, place pillow on the head of the bed with the open end of the pillowcase facing away from the door. And that's it for the return demonstration for bed making. So for the turning and positioning of the client to the bed, the first thing that I am going to do is to assess the client's physical abilities, level of comfort, and ability to follow instructions, to be followed by the checking of the client's chart for diagnosis. So the next thing that I am going to do is to wash hands, and I'll be using an alcohol to control the microorganisms as well as the infection. So the next thing that I am going to do is to organize and check the device for its function. Then the next thing is to identify the client, explain the procedure to the client. So, good day, ma'am. I am Laika Giselle Picumia, your student nurse for today. And for verification, may I know your full name, please?
Jara Kumia,
Your age,
14 years old,
your birthday,
February 13, 2009,
your occupation,
student,
your marital status,
single,
your nationality.
I'm a Filipino.
Okay, thank you. So, ma'am, the procedure that we're going to do for today is the turning and positioning of the client. So, in this procedure po, I will be needing to touch certain parts of your body in order to turn you on the side position. Would it be alright with you, ma'am?
Yes.
Okay. So to start, the next thing that I am going to do is to raise bed to high position, put bed in flat position, secure all tubes, drains, and IVs, and then place or assist client in a starting position. To start the positioning, have the client flex his knees and place his arms across his chest. Then I'll be placing my hands on the client's shoulders and hips on the far side, and then spread the feet and flex the knees and place one foot behind the other while rocking backwards. Gently roll the client towards the nurse. So the next thing is to raise the bedside rails and move to the opposite side. Adjust the client until he or she is in correct side lying position. A pillow may be placed to support client to head and arms. Then raise the side rails on that side and move to the other side of the bed. The next thing is to evaluate client's tolerance and response to the procedure. Evaluate the client's position for alignment. Evaluate any abnormal findings on the skin assessment. So, ma'am, do you feel any pain po while doing the procedure?
No.
Okay. So, record the client's position, record any complaints of pain, dyspnea, and comfort or discomfort rather observed during repositioning. Record the client's response after the procedure. So for the bed bath, the first thing that I am going to do is to introduce self and verify client's identity to be followed by the explanation of the procedure. So good day, ma'am. I'm Laika Giselle Picomia, your student nurse for today. And for verification, your full name, please.
Jara Kumia.
Your age,
14 years old.
your birth date.
February 13, 2009.
How would you like me to address you, ma'am?
Jara.
Okay, Ma'am Jara, the procedure that we are going to do today is the bed bath. And in order to do so, I would be needing to touch your body, specifically from your head down to your toes. So in this procedure po, it will prevent the microorganisms, it will clean the body, remove unpleasant odors, as well as the promotion of the well-being. Would it be alright with you, ma'am?
Yes.
Okay, so the next thing that I am going to do is to gather the equipments needed, and it will include a wash basin, bath blanket, bath towels, washcloth, patient gown, clean gloves, soap, and personal hygiene supply. So the next thing is to perform hand hygiene. So the next is to provide for client privacy, and that includes closing the doors and curtains in order to provide the privacy as well as to give respect to the client. So the next thing is to prepare the client in the environment. So invite a family member or significant other to participate if desired or requested by the client. So ma'am, do you want someone to be present here as I do bed bath?
No.
Okay, thank you. The next thing is to offer the client a bedpan or urinal or ask whether the client wish to use the toilet commodes. Then to encourage client to perform as much personal health care as possible. Then assess each area of skin carefully during the bath. So to start, prepare the bed and position client appropriately. Position the bed at a comfortable working height. Lower the side rail closest to you. Assist the client to move towards you. Place bath blanket over the top sheet. Remove the top sheet from under the bath blanket by starting at the client's shoulders and moving linen down towards the client's feet. Remove the client's gown while keeping the client covered with a bath blanket. Place gown in the linen hamper. So the next thing is to made a bath mitt with a washcloth. Then wash the face. In washing the face, place towel under client's head. Wash the client's eyes with water only and dry them well. Use separate corner of washcloth for each eye and then ask whether the client wants to use soap on the face. Wash, rinse, and dry the client's face, ears, and neck. Then remove the towel from under the client's head. So the next thing is to wash the arms and hand. Place a towel lengthwise under the arm away from self. Wash, rinse, and dry arm by elevating client's arm away from self. Use long firm strokes from wrist to shoulder, including the axillary area. Apply deodorant or powder if desired. So after that is to wash the chest and abdomen. Place bath towel lengthwise over client's chest. Fold the bath blanket down to client's pubic area. Lift bath towel off chest and bath client abdomen with mute hand using long firm strokes. Replace the bath blanket where the areas were dry. Wash the legs and feet. Expose the leg furthest from south by folding bath blanket towards other leg. Lift leg and place bath towel lengthwise under leg. Wash, rinse, and dry the leg using long firm strokes from ankle, knee to thigh. Reverse covering and repeat for other leg. Wash the feet by placing them in a basin of water. Dry each foot, paying particular attention to the spaces between the toes. Obtain fresh, warm bath butter when necessary. So the next thing is to wash the back and then the perineum. Assess the client to a prone or sideline position facing away from the nurse. Place bath towel alongside the back and buttocks while keeping client covered with a bath blanket as much as possible. Wash client's back, moving from shoulders to buttocks and upper thigh, paying attention to the gluteal folds. Remove the and discard gloves if you use. Then perform a back massage after completion of the bath. Then assist the client to supine position and determine whether the client could wash the perineal area independently. If the client could not do so, drape the client and wash the area. Ma'am, can you clean your perineal area independently?
Yes.
Okay. So the next thing is to assist the client with grooming aids such as powder, lotion, or deodorant. Help client put on a clean gown or pajamas. Assist client to care for hair, mouth, and nails. So ma'am, would you like to put on deodorant?
No.
Okay. So the next thing is to wash hands, then record the type of procedure rendered. So for bed shampooing, the first thing that I am going to do is to check the doctor's order for hair shampoo, to be followed by the assessment of the client's condition as the manifestation of fatigue, level of consciousness, and the hygiene needs, then determining the need for assistance. So ma'am, do you feel any fatigue right now po?
No.
How about, do you need anything else po to assist you before we start?
No.
Okay, thank you. The next thing is to gather all the equipments needed such as tap water, bucket, towel, kelly pad, shampoo, cotton balls, and comb. So the next thing is to identify the client and explain the procedure. So, good day ma'am, I am Laika Giselle Picomia, your student nurse for today. And for verification, may I know your full name please?
Jara Kumia.
Your age,
14.
your birthday.
February 13, 2009.
So how would you like me to address you ma'am?
Jara.
Okay, Ma'am Jara. The procedure that we are going to do today is the bed shampooing. And in this bed shampooing, I would be needing to touch certain parts of your body, particularly your head and your hair. Would it be okay with you?
Yes.
So this bed shampooing po will remove excess oil and clean your hair to the scalp. Okay?
Okay.
Okay, to start this, the next thing that I am going to do is to provide the client privacy. Providing client privacy includes closing the doors and the curtains, not only for the privacy as well as to give respect to the client. To be followed by the raising of the bed to proper working level, then wash hands. Washing hands will control the microorganisms as well as the infection. So the next thing that I am going to do is to shampoo the hair as follows. The first thing is to fan fold the top linen to the feet and position a bath blanket over the client. Then position the client diagonally on the bed and place cotton balls on each ear fold. Cover the eyes with folded washcloth, then place a towel around the client's shoulder and neck with the ends of the towel coming together in front. The next thing is to place a curly pad under client's head extending to the receptacle for water. Then wet the hair using a small amount of shampoo, lather it on hair and massage the scalp with fat pads of the finger. Then rinse thoroughly and apply cream rinse as desired by the client. The next thing is if the hair is dirty, repeat step H. Although the hair is already clean now, so I am not going to repeat it. To be followed by the removal of the curly pad. Then pull the towel around the client's shoulder to dry the hair and comb and brush or arrange the hair. Allow the client to assist if available. So the next thing is to remove the rubber sheet and other equipments. Replace the bath blanket with top bed linen and place the client in a comfortable position. So the next thing is to wash hands. To be followed by watching the client carefully for signs of fatigue and evaluate as to comfort and cleanliness. So ma'am, do you feel any fatigue po after the procedure?
No.
Do you feel any discomfort?
No.
Okay, thank you. The last thing is to record the procedure done.